In 70% of epileptics, there is no apparent underlying cause. From this, we mean that definitely there is an underlying reason for the short-circuiting, but that problem is not visible on routine tests. In 25 to 30% of the patients, epilepsy is secondary to prior stroke, head trauma, or infection of the brain. But as we said, in 70% of the people, no underlying lesion is identified on brain imaging. Secondary epilepsy is potentially preventable, i.e., if you prevent a stroke or brain infection from happening, you are also preventing the secondary epilepsy that may follow these illnesses. At times, seizures are because of electrolyte imbalance or less glucose in blood. For example, decrease in blood sodium and glucose levels are commonly encountered causes of seizures. Seizure may be due to consumption of many of the illicit drugs, like alcohol and cocaine. Is epilepsy treatable? In 90% of the patients, epilepsy is completely treatable. We know that it is an illness of the brain and how it is treated. Mostly, treatment is possible through anti-epileptic drugs. These medications are to be taken for long time periods regularly. Duration of therapy is between 3 and 5 years, or maybe 10 years, or even longer. The most effective way of treating epilepsy is timely and regular administration of these drugs. Most of the times, single drug therapy is sufficient. An important point to remember is that good control of seizures doesn't mean that one can stop the drugs. This is because seizures can reoccur if medications are stopped. Our target is complete control of both minor and major seizures for at least 3 years before we can consider stopping these drugs. 60 to 70% of epileptics don't require lifelong therapy, and anti-epileptic medication can be successfully stopped after 3 to 4 years. In patients who don't take their medication regularly, epilepsy may become refractory, and they then have to take lifelong therapy. 90% of epileptics can lead an absolutely normal life. We have medical students, physicians, and PhD doctors who are epileptics. Similarly, engineers and people working in airlines are continuing with their professional lives on treatment. Epileptic patients can continue with their education, jobs, girls can be married off and have children and look after them. All of this is possible if epilepsy is well controlled. Anti-epileptic drugs are usually safe and can be taken for long periods of time. A lot of these drugs can even be used during pregnancy. In children, the anti-epileptic drugs are slightly different, but even then, epilepsy can be well controlled with them. Can surgery help in epilepsy? Only 5% of people with epilepsy have such an illness that it can't be adequately controlled on drugs. Even in them, we have now surgical techniques available. In these epilepsy surgeries, we firstly identify the point in the brain giving rise to seizure and then remove that focus. This is known as epilepsy surgery. So now, in a majority of this subpopulation, seizures can be controlled to a large extent through surgery. What are the precautions for epileptic patients? Epileptic patients have to be cautious about 2 to 3 things while taking the drug therapy. For a specified period of time, we ask them to stop driving, swimming, going alone on heights, or playing video games or watching television for long times. We prohibit them because bright lights, to which they may be exposed to during the latter activities, can provoke seizures in some epileptic patients. Lack of sleep and not taking drugs on time are other important causes of provoking seizures in epileptics. Epilepsy is a treatable medical illness. The key message is that epilepsy is an illness of the brain. It is not something to be ashamed of. This is not due to evil possession or any supernatural phenomenon. It is an illness, just like common cold or pneumonia, etc. It is completely treatable, and with the currently available therapeutic options, living a normal life with epilepsy is absolutely possible. So if someone has a similar symptoms, he or she should see a doctor and get treatment. They should behave and feel like a normal part of society. In reality, these epileptic patients, if properly treated, can become an important part of our society and can serve humanity